Hi, I'm Dr. Laura Mittman, Clinical Operations Manager of the Neil Rearden Center for Regenerative Medicine. Tonight, I'm pleased to introduce Dr. Sarah Trahan. Dr. Trahan is a second-year resident at the college. She conducts clinical research, supervises medical students, and has a private practice where her focus is nutrition, herbal medicine, acupuncture, and regenerative injection therapies. Tonight's presentation focuses on hip pain. I hope you enjoy it.
Hi everyone, welcome to the Painless Forum, where our topic today is going to focus on hip pain. And thank you, Whitney and Dr. Lara, for the introduction. I am a naturopathic physician here at the Neil Riordan Center for Regenerative Medicine. I graduated from SCNM, the college here in Tempe, Arizona, and I'm originally from Louisiana and got my bachelor's in psychology in New Orleans. Aside from medicine in my family, I'm obsessed with horses, so I just put this picture here that I took at from the Salt Lake. These wild horses, thought they were really pretty. And this is the beautiful clinic I get to work in, the Neil Riordan Center. It's really the top integrative pain management clinic where there are medical doctors, naturopathic physicians, as well as Chinese medicine doctors that really collaborate together to be the leader in pain management. And if you're not familiar with naturopathic medicine, we are guided by 6 principles. Obviously, any physician aims to do no harm, but we also like to try and harness the healing power of nature, which is different for everybody. So for example, if you are a desk worker and you're very stressed and you don't have a lot of time to leave your cubicle, you can easily hang a picture of the forest or your favorite flower or some form of nature in your workspace. And just averting your gaze from your computer to this picture throughout the day can be really stress relieving. So that, as well as maybe going outside, getting some sunlight, increasing your vitamin D that way. There are many different ways that you can use the healing power of nature. So we try to incorporate that part of education with all of our patients. Identify and treat the cause. So this is really big when it comes to pain in general, but for hip pain, for example, let's say you have a issue with a ligament in your hip, your labrum. We should, yes, focus on the labrum, the pain generator, but also figure out why you were vulnerable to get that labrum issue in the first place. So working on biomechanics, maybe optimizing your sleep, finding out the root cause of why you had been vulnerable in the first place to obtain the injury that's now causing you pain. And then I think this principle is paramount in our medicine, physician as teacher. Docere is doctor in Latin and it means teacher. And I'm doing my job the best if I can teach you how to move and live better in your body. So you don't have to lean on physicians and doctors for you to be well, that you know how to be well on your own. And treat the whole person. Again, another really important principle. So if you're not sleeping well, you're not eating well, your stress is high, you have diabetes that's not under control, then all these things are going to play into your pain level. And so we're not going to just treat your pain, we're also going to make sure that you're being managed completely so that we get the most optimum result. And then prevention is all of these things kind of play into prevention. So if we're treating the whole person, we're teaching you how to move and live better in your body, and we're treating the cause of pain, using nature where we can, and doing no harm, then we are helping to prevent long-term chronic disease in the future. One way that we do this at the clinic, and I do this a lot with my patients, is to really encourage annual blood work so that we can see throughout the years if maybe, for example, your blood sugar is rising or your liver enzymes are elevated. So then we can make lifestyle and dietary modifications that are going to prevent chronic disease from occurring. The therapeutic order is also something that helps to guide us in treating patients. And with everybody, we need to establish the determinants of health. So what are the determinants of health? This is how you sleep, how you move, your stress level. And if you think about pain, the way we treat pain is using a biopsychosocial modality. And that means treating the biology of the pain, but also your social environment, your social support system, your stress levels, your mental emotional health as well. So sometimes high force interventions are necessary. If someone has a fracture that needs repair surgically, then yes, we encourage that. But we're also going to work on the foundations for optimum health. An example of this, I had a patient who had chronic septic arthritis in her knee, and she was set for an amputation. She was being managed at the Mayo Clinic by an internist, an infectious disease physician, as well as an orthopedist. So I can't help her with the infection in the knee, but I can help her manage her stress. I can help her sleep better. When we sleep, we're in this parasympathetic mode where we heal. And there are many other different ways that you can stimulate self-healing, whether that be through what you're eating. Maybe if you have a lot of negative self-talk, that doesn't do well for stress. And so kind of intervening where we can, finding your obstacles to cure, and then promoting self-healing that way. We also need to support and restore your weakened systems. So for example, if you have a gallbladder removed, then we need to supplement with digestive enzymes that are going to help you break down the foods that you're eating to absorb them to then feed your body. So that's really important, as well as addressing physical alignment. And you'll see this later in the presentation, but when you're addressing hip pain, you also need to be thinking about the joints above and below the hip. So by that I mean your lumbar spine, your knees, your ankles, and your feet are really important. So your feet, as you walk throughout the day, it's absorbing the force of your body on the ground, and that goes all the way up through your hip and then also through your neck and your head. And so if you're not aligned properly, that force can be dissipated inappropriately. And so finding physical alignment that is healthy in the way you sit, stand, move, or play your sport is going to be important. Natural symptom relief. So for example, curcumin, it's a spice and herb that we use a lot for pain relief, and it's been studied head-to-head with non-steroidal anti-inflammatories, NSAIDs, which you might know as ibuprofen or Aleve, naproxen, diclofenac. All these things help to suppress the inflammatory response, but curcumin at a certain dose can also provide pain relief, and it doesn't have the same negative side effects that the NSAIDs have. So today we're focusing in on the hip. It's a pretty simple joint. We're going to talk about the anatomy of it first. It's similar to the shoulder in that it's a ball and socket joint, and it's got quite a bit of range of motion. You can see here the ball and socket joint. The ball is the femoral head, and then you have the thigh bone, which is the femur bone. And then the acetabulum, where the ball is sitting in, is attached to your ilium, which is part of the pelvis. And the acetabulum, this nice shallow bowl, is lined with the slick cartilage, as well as the femoral head. And so the load can be dissipated throughout the joint in a really smooth way. It's smoother than even like an ice skate on ice. Another important part of the anatomy to point out is this bony protuberance here. It's called the greater trochanter. And this bony protuberance, there are muscles and tendons that run along it. And so to prevent that friction, there's this thing called a bursa, which is a fluid-filled sac, kind of like a pillow that sits in between the bone and the tendons and the muscle. If you're looking at the back of the pelvis, you can see that there is that same ilium that we talked about here. And then there's the acetabulum here, where the femur, the ball and socket joint would be here. And then you have your sacrum, which is kind of shaped like an arrow. It's the base of your spine. And I'm pointing this part of the body out because it can be a source of hip pain. So your sacroiliac joint, the joint between your ilium and your sacrum, as we age, all of our tissues in our body degenerate a little bit. And so with that degeneration, oftentimes comes inflammation and increased mobility of joints that maybe are rubbing together too much because ligaments are too lax around it. You can see these nice ligaments on the right side here. If those are unable to hold the pelvis together strongly, the muscles around the pelvis can bear down more and work harder, and then that can translate into hip pain. So what movements does the hip participate in? We're all sitting right now, so we're all in hip flexion. Whenever we're walking, the leg behind us is in extension, and then we can bring our leg away from us and also across our body. So we call that abduction and adduction, and then external and internal rotation. So all the muscles of the hip are helping to guide these motions, and all of these motions or movements are involved when we walk and we run. So the muscles that are involved with these motions, we'll talk about the front part of the body first. So you can see the lumbar spine here, and then hidden away is the ball and socket joint of the hip. And you have the iliopsoas muscle, which is attaching to the lumbar spine, and then to the lesser trochanter of the femur, as well as the iliacus, which is attaching on the front of the bowl of the pelvis onto the femur bone as well. And a lot of these muscles are spanning two joints, right? We have it from the lumbar spine to the hip, and then you have the sartorius muscle here that's running from the hip past the knee joint and then articulating onto the front of the tibia bone. And then you have your tensor fascia lata. Let's look at the side of the body now, which is blending in with the iliotibial band along with the gluteus maximus muscle. And it also crosses the knee joint. So if you're ever having hip pain, you really need to look at the lumbar spine as well as the knee and the ankle, because all these muscles are spanning across different joints. And also the biomechanics as we walk and move are translated from the feet all the way up, right? And we're sitting all day, we're sitting now. And so now this muscle is contracted, the iliopsoas. And every muscle has an agonist, so muscles that help it, and then an antagonist, muscles that work against it. So for example, the iliopsoas, when it's contracted and working, the glute max, which you can see all the way to the right here, is turned off or it's inhibited to allow the hip flexor to work. And then, so I mentioned that because when we're sitting all day, we're engaged in our iliopsoas, and then basically our butt muscles are turned off. And so if you have weak glute muscles, then whenever you're walking, the glute muscles might be a little weaker and unable to hold the pelvis in a good stability. And then that can translate as hip pain. And then I'll just mention the hamstring muscles here. You have the semimembranosus and tendinosus that are attaching to the ischial tuberosity of the pelvis, of the ilium, and then again, crossing and attaching to the sides of the knee. If we peel away the glute max muscle, you can see on the right, there's the glute med. It's this nice fan-shaped muscle that's attaching to the ilium and then to the greater trochanter that we talked about earlier. And then you have your bursa that's on your greater trochanter too, that we talked about. And then there's the piriformis right under it. And then right under the piriformis is the sciatic nerve. And they have anatomical variations. Sometimes the sciatic nerve pierces through the piriformis muscle itself. And so if you have tight posterior chain muscles, sometimes that can clamp down and compress the sciatic nerve and cause radiation of pain down the leg. So hip pain can sometimes present with sciatica, or sometimes sciatica can predispose you to hip pain, because if you have that aggravation of that nerve from the piriformis clamping down on it, then maybe the muscles all around it are also going to be inflamed and painful. So the top, we're going to talk more about the glute muscles. The top picture here is the glute max, and the bottom left is the glute med, and the bottom right is the glute min. So all three of these muscles work in very different ways depending on what part of the fibers you're talking about. So for example, the glute medius muscle here helps you bring your leg away from you, but it also helps to internally rotate the leg as well on the anterior fibers. And you can see when the muscle contracts, it shortens. So you can see when these arrows are pointing toward one another, that's the muscle shortening, and it's pulling on that greater trochanter that you can see here at the bottom. So if the muscle has to work really hard often, then it's going to be pulling on that bone a lot, and that can aggravate it. Also, if the muscle is weak, then the tendon is going to bear a lot of that load, and that also can translate as issues. So let's zoom in a little bit, and we'll talk about the area between the skin and your muscles. So you have fat that lies in between there, and you also have fascia. So what is fascia? Fascia is a connective tissue structure that envelops all of our muscles and envelops groups of muscles so that they can work in tandem with each other. And we have lines of fascia that run throughout our whole body. It's a really dense connective tissue that you can see here. It's innervated by nerves as well. And so also whenever we work out, we're not only working out our muscles, but we're working out the fascia too. The fascia can grow in length and become larger to accommodate growing muscles. It can also shrink and tighten around our muscles. And so fascia is something that we address a lot in clinic when it comes to musculoskeletal work, and especially hip pain. Fascia has a lot to do with it. You can see the fascial lines here, those 12 main lines, and these are just connections, right? From all the way on the left screen, you can see from the bottom of the body that around the ankles, the fascial connective tissue is wrapping around the side of the body along the iliotibial band, and then wrapping across the body through the belly button onto the other side. And one of these fascial chains that I will point out a little more is the one almost all the way to the right, this one right here. So if you have hip pain on the left side, for example, then this will be a little tighter here potentially, or if you've had hip surgery and you have scars in this area, or you've had a past trauma to this area, then there's going to be some tugging and some tension on that left side, which is going to translate to extra tension on the right lower back, as well as the right shoulder. So if someone has hip pain, you also want to look at the fascia above and on the opposite side, because that's a really common presentation. So the nerves that are innervating around the hip coming from the lumbar spine, and they travel through these channels, we call them foramina, and as we age, there can be narrowing of space around these passageways, and whenever there's less space for the nerve to run through, then you have an impingement on that nerve, and then that can translate and radiate to the hip. So it's really important when you're meeting with your physician to find the pain generator, and by that I mean, yes, you have hip pain, but try and recreate that in office. Can you recreate it by addressing the nerves and pinching down on the nerves? Does that recreate your hip pain? Or is it a muscle that's really tight or injured, and that's creating your hip pain? So a really thorough examination is going to reveal where the pain is coming from. And oftentimes it is from these nerves here or from the sacroiliac joint. But we'll talk about common causes of hip pain itself. So osteoarthritis is one of the most common causes of hip pain. And when we're talking about arthritis, you have rheumatoid arthritis, which is more of an inflammatory condition, an immune condition, whereas osteoarthritis is more of a wear and tear issue. And then you have two categories of osteoarthritis, primary and secondary. Secondary osteoarthritis will occur more in your athletes, or if you have had a previous injury to your hip, then you can develop osteoarthritis early on. Primary osteoarthritis will generally occur by 50 or 60 years old, and it will present generally as groin pain or pain and stiffness in your hip. And what predisposes people to osteoarthritis is carrying a lot of weight, especially for a long period of time throughout their body, because that wear and tear has had more chance to get some more friction on it from all that weight. Again, trauma and injury can be a cause, as well as hormonal imbalance. So if your thyroid's not working, your thyroid is this butterfly-shaped endocrine organ that's about at your throat area, and it's responsible for metabolism and wound healing and energy and a whole lot of other things. But if it's not functioning properly, then the cartilage in the hip and other joints aren't going to be able to repair as easily, and they'll be slow to heal. So throughout life, if you are maintaining a healthy weight, making sure your blood sugar is healthy and not too high. Again, blood sugar, if it's elevated, it can decrease your ability to heal wounds. And when we think about osteoarthritis, we can think about the bone having, or the joint having wounds in it. So the cartilage is worn away and you have these lesions basically, where bone is exposed. And so having proper blood sugar and hormone levels can help with this wound healing. And also women are more predisposed to have osteoarthritis of the hip. One, because the angle from the hip to the base at your feet is a little wider. And so that can put extra wear and tear on the joint. And also as we go through menopause, weight might increase. And so that extra load will again cause pain, stiffness, and extra wear and tear on the joint. So let's talk a little bit more about kind of the physiology behind osteoarthritis. We've talked about this cartilage that lines the femoral head and as well as the acetabulum. And what you'll see on x-ray is joint space narrowing. So the space between the femoral head and the acetabulum will be less, as well as you might have some bony protrusions that have occurred in the joint itself. And then again, these lesions here. And so when there's more friction in the joint, when you have the bone rubbing on the bone, that causes pain. And so what does the body do? It sends signals for you to help heal that area. And one way the body tries to do that is it sends cytokines out, the little, they're basically text messages to the body. It's like, hey, can you come over here? We need some more fluid in this joint. So there's more joint fluid gets produced, but it's not that healthy, viscous joint fluid that will help cushion the joint. It's instead filled with inflammatory proteins. And so the joint capsule has to expand to help to accommodate all that fluid. And that expansion is not necessarily normal. And so it can cause extra stiffness in our hip and cause us to not want to move as much. And so if we're not moving our hip as much, the joint capsule will have a tendency to shrink even more or not accommodate that space. And so oftentimes I'll have patients do this exercise where they just easily lie in bed and then just windshield wiper their knees down to one side and then the other. And you're not trying to go past where your symptoms are. You don't go past the point of pain or even to pain. You just go to where there's a little bit of discomfort, kind of snuggle up to that discomfort and then go to the other side. And if you do this daily, you're helping to expand the joint capsule a little bit to help accommodate that fluid, to decrease your stiffness. So then you can load your joint on many different parts of the femoral head versus just one tiny part of it maybe that you were before when you were stiff. So this is a really common exercise I have people do to help increase their range of motion. Bursitis is a condition we see here in clinic, and I think it's overly diagnosed, but it's worth talking about. We talked about the bursa as being this pillow cushion, basically between the greater trochanter and the tendons and muscles that are running on the outside of it. And so the iliotibial band is one of the main muscles that's rubbing on it. And so if you've recently increased your activity, you're running up hills a lot more, or the distance that you're working out is more, the intensity is increased, then there's all of a sudden extra pressure on the bursa. Or if you have a tendency to sit with your legs crossed, oftentimes that can contribute to compression of the bursa. And same thing with the joint. What does the body do when it's in pain or there's an issue? It sends out these little signals for the body to respond, bring more fluid to the area to help heal the area. But that can oftentimes be an inappropriate response, or it goes on for too long, and then that can cause an issue. So one of the best things to do is when you are having hip pain and it is bursitis, is to take that pain as a cue to rest. So pain it's not supposed to be an oppressor. It's supposed to provide information. It's protecting you. So that pain signal is being sent out so that you can change the way or change something about your life, whether it's how you move, it's what you're eating, the activities you're engaging in. So oftentimes with bursitis, there just needs to be more rest and less compression of the lateral hip. Going into iliotibial band syndrome, this is the band of tissue that's running over the bursa, running over the greater trochanter. And it's formed from the tensor fasciae lata here, this tiny muscle, but very strong. And then the glute max muscle behind, it blends together. And it's also kind of on the rim of the pelvis. So where your pants sit about is where this muscle our tendon is starting. And then it spans all the way down to something we call Gerdy's tubercle, which is just a bony protuberance on the lower limb and the knee. And so if you've recently started running uphill, or you're running on these surfaces that are banked, so you're uneven whenever you're running, or if you have flat feet, or you have inappropriate footwear, old shoes, all these things can contribute to iliotibial band syndrome. And also as we age too, there's less elasticity in this band. And so there are many different ways that you can address this by helping to relax the iliotibial band or the IT band. But it can be a very common cause of pain, especially in our athletes. And so if you have flat feet, we talked about this a little bit, but if you have flat feet or the arch is fallen, or you have weak ankles, then this tibia, the lower leg, is going to internally rotate. And then what happens when it does that is the IT band that's running across the side of your body and then attaching onto your knee is being pulled on. And so if you work to lift your arch, strengthen your ankle, fix the biomechanics of how you're walking or playing your sport, then you can decrease that tension on your IT band. You can do trigger point therapy too. So you can take a lacrosse ball or a tennis ball or a foam roller, and you can run along areas of tension. Now, I wouldn't say everyone go out and buy a foam roller because they have foam roller junkies out there and we have to control them. These are people that are constantly foam rolling the TFL or other areas, and you really shouldn't do it all every day. You should do it for a little bit of time on the muscle of concern and then move on. Right, so trigger point therapy can be helpful, foam rolling can be helpful, but speak with your physician, and we go over this in clinic visits when I meet with patients about a good schedule that they can utilize that will help them and not hurt them when doing these therapies. Tendinopathy is one of the most common things I see in clinic, second to osteoarthritis, and oftentimes when you have tendinopathy, it's because you've injured the tendon, there's been a trauma to it, or the muscle is not being used a lot. So for example, we talked about the iliopsoas muscle that runs from the lumbar spine onto the femur. That muscle works all the time. And so maybe our glute muscles are inhibited a lot. And so when we go to walk, or you're like, oh, I'm going to go hike Camelback this weekend. So you go hike Camelback. Well, your glutes weren't used to being used that much. And so the tendons are going to bear a lot of that load because the muscle can't fire as much as you might need it to do the activity you want. And over time, it can degenerate with excess compression. So again, hanging on one hip, crossing your knees repetitively, all these things are compressing the tendons. And so fixing faulty movement patterns, fixing these habitual ways that you sit and stand and hike or do your activities will help with tendinopathy. And oftentimes rest is really all you need. And it can be from 6 to 8 weeks sometimes. And that's hard for people to do, unfortunately. There are therapies, injection therapies that can help with tendinopathies, and we'll go into that a little bit later. But let's look at this picture down here on the right. You can see on the left side of the picture, you have these tendon fibers that are running nice and smoothly, right? But when there's an injury, there's a wound, you have neovascularization. So you have formation of new blood vessels, which you can see on the right side here, it's split. And then what the blood vessels are trying to do is trying to bring cells to the area, collagen to the area, enzymes, cytokines, to help lay down collagen, to help strengthen your tendon. But just like a car or just like a roof, whenever you get into an accident or there's been a storm and then there's a hole in the roof, for example, and you go to patch your car up or your roof up, then it's more vulnerable to injury in the future, right? So your car depreciates in value, your roof will also depreciate in value, and you'll be more vulnerable in the future. So rest injection therapies, as well as resistance weights, can be really helpful. If you're loading the tendons with some slow, mindful weightlifting, that can be really helpful for them to get a little stronger after they've been through a period of rest. And there should be a slow ramp up in your activity after about 6 weeks if you have tendinopathy or tendinitis. It shouldn't be you're doing what you were doing before the injury all of a sudden. Got to ease into it. And when we were talking about the fascial lines in the body, so one of the lateral lines that are running on the side of the body where the IT band is, and then it crosses in the back, the more that you're flexed whenever your belly goes closer to your thighs, that is even putting more pressure on your hip due to these fascial connections. So if you sit on something a little more elevated, that can help increase the angle from your thigh to your torso. And also if you sit in a recliner at night, that can be very comfortable. And also it's helpful to decrease the pressure on your hip. So finding ways to sit at work and at home that are going to be beneficial for you and not cause extra compression is going to be helpful to decrease the degeneration that can occur with a compressed, overused tendon. And this is a really easy exercise that you can do at home in bed if you have tendonitis. But again, speak with your physician before doing these things. It might not be right for you, but it's pretty easy to just lie in bed, place your hand, your thumb over your glute max muscle, and you can see your 4 fingers that are on your tensor fasciae lata, your TFL. And then just with a nice straight leg with the problem hip up, you'll just lift your leg maybe a few inches off the bed. And what that's doing is it's engaging the muscle without a lot of weight bearing on the tendon. And so you can help to rebuild the musculature or recondition your muscles without loading your tendons. This can be really helpful for osteoarthritis as well, because whenever you look at someone with osteoarthritis of the hip, they also have very deconditioned gluteal muscles, and that's something to be addressed. So before we go any further, can I help to answer anyone's questions about what we've already talked about?
We have one question for Dr. Trahan. The question is, if you have a lot of pain from your injury, how do you rest to heal? I don't want to take any pain meds.
How do you rest to heal? That's the question? Well,
Correct.
Find something else to do that's very sedentary. You can find a book, a new activity that helps you to rest your body. And you can even, if you have a hard time resting, you can rest your lower body and then maybe do bicep curls, work on your arms, like find another activity that you can do that might distract you from being more sedentary in your lower extremities. And also finding meditation techniques can be really helpful. There's a whole mind-body connection when it comes to pain too. So if you have an injury, then your brain remembers that. And so it can still send pain signals down even when there's no injury. And so if you can even close your eyes and imagine yourself running or doing the sport that you love to do or the activity you love to do, maybe with your grandkids, gardening, any of those things, just imagine yourself doing those things in a meditative state. And that can help rewire that brain and body connection to help decrease pain and help healing as well.
We have another question here for Dr. Trahan. What are the steps taken to properly diagnose the source of hip pain?
Yeah, so whenever people come to clinic and they're new or we've seen them before, they'll come in and say they have hip pain, for example. So I'll sit down with them and ask them to describe their experience to me. And then I'll go through just an inventory of their foundations for health, right? We talked about sleep, energy, fatigue, mental, emotional health, really dive into their social history and also their diet, their medications they might be taking, because that could play a role in healing. Supplementing with potential nutrient deficiencies can be helpful. And finding out who's managing maybe their other conditions and how we can better take care of them as a whole person. So after the extensive history and getting to know each other, then we'll move into a physical exam where we look at range of motion. So I'll have the patient stand up and then have them squat and do other active ranges of motion and find where they're limited. And then maybe I'll move into orthopedic exams and testing their nerves and the joints above and below their area of concern. And then doing a biomechanical assessment. So looking at how they're standing, their posture, maybe have them walk or run in the clinic so we can see the muscles they're recruiting and if there's any gross issue that we can address in clinic. And we have a variety of physicians here of different expertise. And so lots of hands on deck, a very collaborative experience when it comes to addressing your concerns.
Our next question is, what exercises can I do to stretch out my hip flexor muscles?
Yeah, so something really easy you can do to stretch your hip flexors, especially if knee issues, is just to lie in bed and then kind of shimmy yourself to the side and let maybe your right leg, for example, hang off the bed. And so Your butt and your back and your left leg, for example, are supported by the bed, but the right leg is extending toward the ground, and that's helping to stretch that, that front iliopsoas muscle.
Our next question is, how invasive can hip treatments get?
So it depends on the issue, and we'll talk a little bit about a case later that was probably the most invasive in terms of treatment. So I'll wait to get into that, but it can be something really simple as diet and lifestyle changes that can go a long way for people. Sometimes acupuncture once a week or twice a week for 4 weeks can help to get people out of pain and back to their normal life. And acupuncture is really non-invasive. It's kind of like a spa treatment. And then we'll employ cupping therapy sometimes. And cupping therapy is just using a manual decompression technique. It's an ancient Chinese medical therapy. It probably originated with the Egyptians and other cultures, but that can be really helpful to bring healing to the area. And then there's injection therapies, and there are a wide array of those, ranging from prolotherapy, platelet-rich plasma, bone marrow aspiration, and all these things we can do here in the clinic, just depending on your need.
Our next question reads, my back is stiff and painful when I get out of bed. It loosens up with some stretching after 20 minutes. I have had severe low back issues in the past, but not in 6 years. What can I do?
So the issue is, I guess, how to help prevent the back pain from flaring up again. So one thing I would say, what's that?
Yeah, go ahead.
Okay.
No, that's perfect. Thank you.
So one thing is to figure out the holes in your health, right? So why does your back flare up? Where are you vulnerable? So you're really good at compensating with other musculature, but sometimes that compensation pattern. So say, for example, your low back hurts, maybe there's some tension along the muscles of the spine, or your core muscles, your abdominal muscles are pretty weak, or maybe the pelvis is weak, and so the low back has to work a little harder. And it gets tired after some time. And so when your compensation wears down, then that pain flares. So I would say having a good physical biomechanical assessment to maybe see where you might be out of alignment. Is there a leg length discrepancy? So is one leg longer than the other? Is there a fallen arch? Are your ankles weak? Are you prone to ankle sprains? So getting a full biomechanical assessment can be really helpful. Regular massages can be helpful as well. And then also I would say just strengthening your core. There's a physician, Dr. Stuart McGill, and he might be a chiropractor actually, but he has done extensive work on core stability and how that helps to prevent low back pain. And so I would say looking into him or coming to the clinic, I can point you in the direction of his work as well.
Our next question reads, my friend raved about his stem cell treatment for his back. I get these lame flyers in the mail, but pretty much throw them out. Do you do stem cell treatments?
That's a big topic, and we can talk about that more one-on-one. But mesenchymal stem cells, or as the person who coined that name maybe prefers it to be called, message signaling cells, are found all throughout your body. And they're in your bone marrow, they're wrapped around your blood vessels, they're in your muscles and your tendons. But they also are in amniotic membrane and umbilical cords. And through the harvesting of live, healthy births, harvesting the tissue of the amniotic sac and the umbilical cord, you can take this tissue, and the studies have shown that they do have markers in some of those tissues that are stem cells. And so there are a lot of clinics out there that claim that they have stem cells, but a lot of them are frozen or not preserved appropriately. Excuse me, they're just not preserved right. And so some of their efficacy or their stemness might go down with time. And so they might not be as effective as the people claim that they are. But We do use structural tissue here, that's what I'll call them, and they are from live healthy births, the amnion, pieces of amniotic sac and umbilical cord that are anti-inflammatory and really work on the immune system to help with pain. When you have a degenerative disease like osteoarthritis, your body is in kind of a catabolic, a breakdown state, and we want to make it more of an anabolic building state. And that's what some of the injection therapies like the structural tissue can help with.
Our next question reads, what's the best way to check or ensure someone is sitting on their sit bones to avoid back or hip soreness later on?
Yeah, so you can do just some pelvic rocking in your chair. So one thing that you should always probably do, and it's really hard to do, but keep your feet planted on the ground when you're sitting, and then you can kind of rock your pelvis forward and rock your pelvis backwards and find that equilibrium where your pelvis is tucked enough so where you feel supported. And you could even get a mirror on the side of you and see, or a friend to help you, right? Is my earlobe going through my shoulder, and is that line going through my hip? So sometimes we sit like this with this forward rounded shoulders, this forward head carriage, and that puts us in front of our sit bones. So just every now and then rocking back, or maybe having a friend help you to align your posture better can be helpful, as well as that balance disc that I showed earlier, that person sitting at the desk. Having that under your sit bones can be helpful because it constantly kind of has you recorrecting over your sit bones. As long as your feet are on the ground, you have a nice angle from your torso to your femur, then that can put you right on your sit bones.
Perfect. And for our last question, before we get into the demonstration, after I exercise, my hips are extremely tight. Stretching only helps a little bit. Would you suggest to help me feel well enough to keep what would you suggest to help me feel well enough to keep working out? It's the only thing that keeps me happy these days. And as a reminder to our attendees, we will have another Q&A session toward the end. So if you have any other questions, you're welcome to submit those as well.
Yeah, so I see a lot of this in clinic. Someone who has tight hips and they don't want to rest. They want to continue working out. It makes them feel good. Exercise, it breaks down some of the adrenaline that we produce when we're stressed. It increases dopamine, right? So it feels good. And so we want to get back to our activity as quickly as we can. And one way that we can do that is through cupping therapy. So I mentioned that earlier. It's that manual decompressive therapy that's from an ancient traditions, one being China, and it helps to bring blood flow to the area. And I can show you this slide. Your question kind of flowed in quite nicely to the presentation. Thank you, whoever asked that. The cupping therapy has many different mechanisms of action, but one, it brings blood flow to the area through the process of increasing nitric oxide. And so what that can do is help when you're not using your muscles a lot, or when the muscles are stiff, the venous flow can be, or the blood return can be slower. And so to help that a little bit along, you can put the cups on there, and it helps overall venous return and blood flow. It also helps to activate the immune system so that you have more of an anti-inflammatory effect as well. And it helps muscles and tendons and nerves glide along one another a little bit better, especially if you've had a history of surgery in your hip or other parts of your body. Doing cupping therapy can be a great way to release some of that tension and help the easy glide between the fascial layers a little bit better. So I'll actually be demonstrating cupping therapy today. We have a wonderful model that's here with us, and we'll just transition over to the treatment room right now. All right, hi everyone. We have Sandy here. She's our wonderful model. Thank you again. So Sandy has some right-sided hip pain, and she also has left low back pain. So we were talking about earlier those fascial lines. So she has a really tight fascial line that's right here on her right hip, and then also on her left lower back. And then I've looked at, we've talked already, so I'll show you a little bit of on the side, her posture. So she's a medical student, so she spends a lot of time studying, sitting down, listening to lectures virtually. So you can see the earlobe here is not fully right in the middle where we want it to be. And so for Sandy to help address her hip pain, I would also address her posture and the head carriage and probably a tight piriformis muscle. But for the cupping therapy today, we're going to focus on her right hip and then her left low back. Okay, so you can go ahead and lie down for me. All right, so fire cupping is what I employ a lot in clinic, but people will do other types of cupping using kind of a vacuum device that helps to pump the air out. But what the fire does is it helps to decrease the oxygen in the cup, and then it creates a vacuum. So I'll be addressing this part of her leg. If we were in a treatment room and this was a kind of a real treatment session, we'd also be putting the cups around this area. And it's painless, it's very relaxing. So Sandy's just gonna feel a little bit of warmth from the fire and then that nice negative pressure. All right. So there would generally be more cups in a treatment session, but you can see kind of what we're doing here in terms of treating the fascial plane on the right hip and then on the opposite side in the low back. And then Sandy didn't scream. I think she's having a nice relaxing treatment here. And so that's about all that entails. So we would let the cups stay on for about 5 to 10 minutes until you get this nice petechiae or blood vessel kind of come to the surface. And then sometimes people might be a little sore, it's a little bruised, but most people don't experience any discomfort after the treatment. In addition to biomechanical analysis and nutrition evaluation, lifestyle investigation, we can also use nutritional approaches to pain and musculoskeletal health. And we have a lot of nutrients listed here. So let's go through a little bit of them. I think a lot of us have already heard about vitamin D. But taking vitamin D alone is not going to be that helpful. You need a certain form of vitamin D, as well as vitamin K. So vitamin K can help bring vitamin D to where it's needed versus just hanging out in the bloodstream. Also, to prevent osteoporosis and to maintain bone strength, you'll need calcium, magnesium, and multiple other nutrients that help to absorb these nutrients, and they work together. It's like the synergy effect. So it's not just one nutrient that's going to help, it's a combination of them. But don't just go out and buy these nutrients separately or in combination. There are therapeutic doses that have been well studied. So for example, vitamin C. You can get vitamin C at like 20 milligrams all the way probably up to 2,000 milligrams. But what's going to be really beneficial for maybe a tendinopathy or in conjunction with an injection therapy will be higher doses of vitamin C. And they can have side effects, and so it's important to speak with a physician to kind of figure out how to mitigate those side effects. And there aren't very large ones, it's usually just kind of loose bowels, and so speaking with a physician to get on a good supplement regimen to help supplement your diet can be very helpful. Glucosamine and chondroitin, these are fabulous nutrients. They've been studied over a long period of time to help prevent joint space narrowing. So before we had talked about osteoarthritis, and part of this condition is having a narrowed joint space. And so over time, if we can help prevent that with nutrients, that can be really a great alternative to having to deal with the pain and stiffness of arthritis later on down the road. And glucosamine and chondroitin are also helpful pain relievers, but it can take about 6 weeks for them to kick in. So being educated on the use of these nutrients is going to be really important for you to know how to use them effectively. And if you're on other medications such as protein pump inhibitors, PPIs, if you have gastric reflux or gastritis, so inflammation of the GI tract, or hydrogen chloride production is off, and so you need a PPI, taking this medication is going to impair your calcium and your magnesium absorption. So getting on a schedule where you're taking this nutrient away from this medication is going to be important. If you're on metformin for diabetes, that impairs your B12 absorption. And B12 is a really important vitamin for nerves, for energy production, for healing in general, and musculoskeletal health. And so being aware of what nutrients you might be deficient in because of some medications you're taking is part of the well-rounded and comprehensive approach that we'll take as we work together. And then antioxidants are really fabulous for disease prevention and pain relief. We mentioned curcumin earlier. This is turmeric, but also green tea, ginger, really dark berries like strawberries and blueberries, blackberries. All these things are rich in antioxidants and can help the repair of musculoskeletal injuries and nerve injuries. And you can get a lot of these antioxidants in green leafy veggies. Also salmon, that's a really great source of fatty acids, and it can help quell prostaglandins, so these chemicals of inflammation and pain. The fatty acids in salmon can be really helpful. So finding where nutrition can be added into your life to help with your concerns. And proper hydration, it's an interesting one, but it's so important. Our bodies are made of water. The discs in our spine, the muscles, we're largely water, and so we need to be properly hydrated. The general rule is half your body weight in ounces, and that can be difficult to achieve, especially if you need to drink more water if you are kind of chronically dehydrated with caffeine or exercise, or maybe you're in a sauna, maybe you live in Arizona in the summertime. It can be difficult to be hydrated, but they've done studies where people are dehydrated versus hydrated and introduced a pain stimulus, and those that were hydrated had less perceived pain than those that were not hydrated. So water intake is a really crucial part of pain perception. We talked about this as well a little bit, but I'll just kind of show you this. You see this man all the way to our left, he's hanging on his hip. And so that hanging on the hip is compressing the bursa, compressing the tendons, and putting extra load on the femoral acetabulum joint, the hip joint itself. And that's going to exacerbate wear and tear. It's going to exacerbate tendon degeneration as well as bursa inflammation. And then the way he's sitting in the middle and all the way to the right is also doing the same thing. So it can be hard to break these habits. So get the encouragement of your family and friends or your coworkers to help you kind of snap out of it if you're doing it too much. The way you sleep can also be very important. So placing a pillow under your knees so that you're not adducting or bringing your knees together while you sleep will be a good way to decompress the hip, as well as getting a eggshell mattress topper can be helpful in dispersing the weight on the hip. And then different treatment options that we have, diet, lifestyle, muscle conditioning, gua sha, which you can see to the right here. It's just this muscle scraping, which can help to address the fascia and bring blood flow and healing to the area, as well as acupuncture and cupping. And then some injection therapies. Trigger point injections are helpful for local anesthetics to be introduced into muscles that are extra tight, and so it can help relax those muscles. Prolotherapy uses a proliferant, like it's called dextrose, with a local anesthetic that helps to increase the tensile strength of ligaments and tendons to help them heal a little bit better. Platelet-rich plasma. Platelets are the wound healing cells, so they go to work whenever you have a cut and help to patch up the area. So you can utilize them in osteoarthritis when you have these cartilage patches, and the platelets can be introduced right into the hip joint and also help to create this anabolic state where you're building versus breaking down soft tissue. A very good alternative compared to steroid injections, which soften bone and connective tissue. And so let's go into this case real quick and we'll talk about the bone marrow aspiration and the structural tissue. I had a patient who was a 62-year-old male. He's an engineer, a grandfather. He had a past history of diabetes and he was once obese, but he had been working with us at the Southwest College of Naturopathic Medicine as a patient, and he had normalized his weight. He was in remission from diabetes, but he couldn't kick his hip pain, and he went to physical therapy and that didn't help. And after going to Disney World, he realized that it was really a problem. So his x-ray showed advanced degeneration of his joint. And so the best treatment for him was to use bone marrow aspiration, concentrate those cells, and then put it with some structural tissue, some amnion tissue. It's like putting older dogs with puppy dogs. Everyone's a little more active, a little more excited, and they can work a little better for you. And so about 3 months, 1 to 3 months after his injection with the BMAC and the amnion tissue, he had really great results. So 100% is full function. He started off at about 72%, so C minus, right? And then his pain improved. He had much less pain. Instead of experiencing it daily, he experiences it maybe monthly. And so he's at 90%. His stiffness improved, his quality of life improved. So he's really happy with his treatment, and it's about 1.5 years out now, and he's maintained these improvements. So if any of what I've talked about tonight sounds like you or sounds like a concern that you have, I'm happy to meet with you. Or if you have other pain concerns, my specialty really is preventative and regenerative medicine. So where can I intervene and help you obtain optimal health, also help to be an alternative to chronic disease management. I'd be happy to help you, and thank you all for tuning in. It was so great to be with you tonight, even if it was virtually. And if you would like, we can schedule a free 15-minute consult. You can just call the clinic and mention that you saw this webinar, and we can get you set up.
Thank you so much, Dr. Trahan. We do have a few questions. And if any attendees have any additional questions, you're welcome to enter those using the Q&A button below, or you're welcome to save them for your free 15-minute consultation with Dr. Trahan. Our first question regarding the demonstration, can your patient describe to us how the cupping feels?
Well, I don't know if we can get Sandy to do that, but I've experienced cupping and it's very relaxing. You know how sometimes you're just sitting down and you need someone to just kind of put some pressure on your trap right here and give you a massage? It's that same relief that you get with that. And it helps to kind of normalize the body. So if there's extra tension in the left hip and the right low back, if I decompress those areas and take the tension away, there's overall relief, especially when you're walking out the clinic. We'll get immediate feedback in terms of pain relief that can last a while.
Thank you so much. Our next question reads, I'm pretty self-quarantined during the pandemic. Are you seeing patients in person? Is it safe? What precautions are you taking? And could I do telemedicine instead?
Yeah, so we're all set up to do telemedicine. So we can do virtual visits. If you come to the clinic, we've made sure to stagger patient appointments so there's not a lot of patients in the clinic at one time. We're sterilizing the rooms before and after every visit. We've got a whole system in place so there's not too much interaction with other patients at all. We're wearing face shields and face masks in the clinic as well. So we're taking the proper precautions to continue to meet with you and address your concerns both virtually and in person.
Excellent. And we'll do one last question here since it's close to 7 o'clock. But as a reminder, if you have any additional questions, you're welcome to give the Neil Riordan Center for Regenerative Medicine a phone call. Let them know that you saw this webinar and schedule your free 15-minute consultation with Dr. Trahan. For our last question, how do you know when it's right to either rest or exercise?
Yeah, so I mean, speaking with a physician or a physical therapist or your healthcare provider can be a way to guide you, but pain is, like we said before, it's protective, so it's information. And so if you can move in a way maybe a little bit differently than causes you pain, then you can still move, right? And so finding a way to walk that's not painful. So for example, if you have hip arthritis in the right, using a cane on your left side might be what you need to help relieve that hip pain. And so you might not need to rest. You might just need a cane to be used appropriately to then do your activities as you were before. But if you ever are experiencing pain, you need to back off that activity a little bit and find a way to move around it. In yoga, we call that meeting your edge. So go right to the place of discomfort and don't go any further. You likely won't cause too much damage at all, but it is definitely a signal that your body is sending you to do something differently. And so find ways that you can move that doesn't cause your symptoms can be very helpful.
Excellent. Thank you so much for your time tonight, Dr. Trahan, and thank you everyone for tuning into our Painless Forum for hip pain. As a reminder, you're welcome to schedule your free 15-minute consultation with Dr. Trahan by giving us a phone call or using the link to sign up for your free 15-minute consultation, which you'll receive via email. Thank you so much again for your time. Have a wonderful evening.
Thank you.